Tonight, multiple civil lawsuits are raising questions about patient safety and oversight in women's health care. Austin Reed talked with attorneys, advocates, and local leaders about what these filings could mean for the future of medical accountability.
The lawsuits center on a longtime Tri-Cities OBGYN, and they claim that both the doctor and the hospital system failed to protect patients. But beyond the legal fight, this is also sparking a conversation about how to rebuild trust in healthcare. When you make an appointment with your doctor, it's about more than just your schedule. The relationship between patient and doctor should be about respect and, above all, trust. Trust that you are getting information or doing things that will help you live a happy and healthy life. But what happens when that trust is shattered?
My life will never be the same. I don't view doctors the same. I don't view medical procedures the same. I question everything, and I don't view intimacy the same anymore.
The National Institutes of Health, commonly referred to as the NIH, says there isn't a lot of data that measures the extent of sexual abuse of patients by their doctors. The reason? It goes largely underreported. Patients oftentimes are consumed by guilt, shame, even shock that it happened to them. Rosanna Herrera is the program director of SARC in the Tri-Cities. SARC provides advocacy and support to survivors of crime.
Some may even question themselves and wonder if they are overreacting. Did I think, is this something, should I say anything? How is my feelings valid?
Another factor, the NIH says even when sexual misconduct by a licensed physician is reported, very few cases are acted upon, leaving victims even more vulnerable.
That healing journey is different for each person. They may not want to go get medical care in the future. They may feel like or prolong accessing medical care because they are worried about their experience.
The topic has been put front and center locally after a Richland doctor and surgeon is under investigation by the Washington Medical Commission after being accused of having inappropriate boundaries and unprofessional conduct, including that of a sexual nature toward his patients. For more than 2 decades, Dr. Mark Mulholland practiced OBGYN in Richland, affiliated with Cadleck Regional Medical Center and its Associated Physicians for Women clinic. Since July, dozens of women have filed civil lawsuits accusing him of sexual misconduct and performing procedures without consent.
He performed a surgery that I had no idea he had done.
According to the statement of charges from the Washington Medical Commission, Dr. Mulholland is accused of commenting about patients' bodies, like body shaming them for being overweight, or making sexual comments about women's body parts, like their breasts and vaginas. Patients say Dr. Mulholland would also comment about their sexual activity at length that didn't relate to a medical purpose, and some patients even accuse him of touching, rubbing, or grabbing them inappropriately. The women involved in these lawsuits say their experiences left lasting trauma, claims that are now part of the civil filings.
I tend to be vigilant, more so now, but I also understand, I've done enough work to understand that this experience isn't isolated.
Attorneys representing the women say these accounts reflect warning signs seen in other states.
I just settled the largest doctor-patient sexual abuse case in Illinois' history against an OBGYN in Chicago. My father lives in Richland, and I graduated from Camican High School. And my dad sent me the article about Mulholland being under investigation by the Washington Medical Board.
Holder and co-counsel Elizabeth Hanley have filed multiple suits arguing the healthcare system failed to protect patients.
When you are giving birth or when you're getting information about one of the most intimate but a very important part of your body, You need to be safe.
It's not just Dr. Mulholland under fire. It's also Cadleck Regional Medical Center. Attorneys for the women say the hospital failed to protect patients, and the State Medical Commission says complaints made about Dr. Mulholland's behavior toward patients and staff were often rationalized, normalized, and minimized, meaning patients say they weren't taken seriously. Cadleck Regional Medical Center declined to comment on the pending litigation, but confirmed Dr. Mulholland is not currently practicing at their clinic. Dr. Mulholland has not been criminally charged. We asked the Richland Police Department if they have an active investigation regarding Dr. Mulholland. They did not provide specific records, but did tell us some records we requested are part of an active investigation. According to a 2016 nationwide investigation by the U.S. National Practitioner Data Bank, found that for the thousands of medical board orders for doctors who were disciplined for having a sex-related offense of a patient since 1999, found more than one-half were still licensed to practice. Furthermore, the same analysis shows that medical boards did not discipline 70% of the physicians who had peer review sanctions or malpractice payments made on their behalf due to sexual misconduct. Advocates say even as these cases move through civil court, there's an urgent need to rebuild trust in healthcare.
They aren't sure where to go. They aren't sure who to talk to, who's safe. A victim service center like SARC is the place that is helpful for them to access services that they need, to help them know what options they have, and if they want to make a complaint to the hospital or medical facility, they could. If they wanted to go to the medical board, they could.
Statewide, Washington now requires written consent for pelvic exams on unconscious patients. Hospitals are also reinforcing chaperone policies and staff training.
I'm not in this for myself. I'm in this to speak up for the women who don't want to come forward, who don't want to speak up, who are afraid to speak up, who did speak up but yet got ignored, who complaints got somehow disappeared. I want to be all those people's voice.
Bottom line, these lawsuits are about more than one doctor. They are about accountability, trust, and making sure patient safety is never just a policy on paper. And SARC says anyone who believes they have experienced sexual misconduct in a medical setting can call their 24-hour confidential hotline. That number is on our website. The lawsuits against Dr. Mulholland are still pending. The Washington Medical Commission has ordered the doctor to restrictions in his practice, as he is not to engage in the practice of medicine with any biologically female patient or those who identify as female, including in a consulting role. Dr. Mulholland's license to practice is currently active. Austin Reed, Apple Valley News Now, investigates.
If you have a story you would like for us to investigate, be sure and send us an email. Just write to investigates@applevalleynewsnow.com. Apple Valley News Now, on your side.